Last year, the US government shut down the agency that was responsible for running almost all of its global health programs. It was almost done on a whim. So people got an email on Sunday night that they were fired and they shouldn't come to work the following day. Hundreds of programs were just terminated abruptly. Everything from HIV treatment to TB care, malaria prevention, therapeutic feeding. But here's what almost nobody was asking. When you shut down a global health program portfolio of billions of dollars, what happens to that money? Does it vanish or just pile up in the corner? Does it get diverted to something else? Before we get to the answer, let's recap what this dismantling of global health looked like. The Department of Government Efficiency, or DOGE, trumpeted the dismantling of foreign aid as one of its first major political victories. The entire USAID office in DC was closed, and over 60 USAID missions around the world were also closed. It was completely chaotic. USAID staff were instructed not to speak and explain what was going on, and honestly, they probably didn't know what was going on either. Clinics didn't know if drug shipments were still coming. Doctors and nurses didn't know if they still had jobs. There was no transition plan or staged handoff, nothing. Everything just stopped. It was pretty crazy that there was no information, especially in a space like global health, which historically has tried to be very, very transparent. It just seemed like terminations of programs were being made completely randomly. Now, publicly, there were plenty of accusations of fraud and abuse. There were viral examples of obscure global health programs. Large NGOs were attacked for being bloated. There was one congressional hearing where DOGE presented some spreadsheets of hundreds of terminated awards. And that was it. By that point, most of the staff were gone and there were just a handful left. They didn't want to talk or they couldn't talk. So if you wanted to know what actually happened to billions of dollars of global health funding, there was literally nobody to ask. And that's the way it's been for months. A while back, we started thinking, what if we could independently verify what happened to global health funding? And it turns out there actually is a website called USAspending.gov that charts all of US government spending across all of its agencies. But the search function is complicated. It fragments the data. It's hard to understand the entire picture. So we pulled these large data sets of financial information and made them into something more usable, a dashboard where you could see patterns. How much is being obligated and where is it going over time? And I promise you, this is not going to turn into a 45-minute discussion of spreadsheets. But nobody in government is going to tell us what happened to global health last year. And the only way you're going to understand is to look at the financial data. In US government terms, an obligation is a promise to pay. It's not the same as a payment. Now, payments usually follow the obligations if that work is being done. But the interesting thing about obligations is that there's a deadline. So when Congress appropriates the money has to be obligated by a certain date or that money expires. And you can see here, global health spending in 2025, last year, was $8.6 billion. That's less than the year before, which is $12.6 billion, but it's not nothing. The story here isn't about collapse, it's about what happened to the money. And we can see that by looking at the recipients tab. Last year, there were 558 recipients, and that's a lot less than the year before, 917. In fact, if you go back, you can see that there's been a steady increase, 844, 871, 917, and then suddenly this sharp decline. You need a broad ecosystem of partners. You want to have the right organization in the right place with the right cultural and language expertise, and especially the right technical experience. So last year, that ecosystem contracted markedly. And it's more dramatic when you look at the second part of the year after the dismantling of USAID. You can do that yourself. You can go to my blog post where I made a really fancy slider. In the second part of the year, it was even less, 346. Hundreds of awards were terminated, and so there were obviously going to be a lot less recipients. But remember, funding didn't fall off a cliff completely. $8.5 billion had to be obligated to a lot fewer recipients. Look at the share of total obligations that's held by the top 25 recipients. If you focus on the second part of the year after the terminations of awards, the share held by the top 25 recipients was an astounding 91% of all U.S. global health monies. This is highly abnormal. You know, it's tempting to talk about winners and losers, and certainly if you look at the numbers, you can see that there were some large U.S. organizations that got huge increases in obligations last year. We're talking about hundreds of millions of dollars. We can guess what happened. USAID is dismantled, and there's only a few staff left, not enough to come up with new projects or to ask for proposals or review those proposals or basically manage a very complicated global health portfolio. The deadlines are looming. Money is about to expire. We're talking about hundreds of millions of dollars. It has to get out the door. And where are you going to put it? There's only a few award mechanisms left. And generally those are for the larger, more established organizations. And I wouldn't be surprised that within these organizations, there's a lot of skepticism about these obligations. And that means reluctance to open up new offices and hire a whole bunch of new people to do a lot of new programs. Historically, payments follow obligations. But we know in this administration, they've been completely willing to blow up their own promises based on whatever culture war is popular at the moment. When the people who are funding global health are chaotic and incompetent, everybody loses. Now, there's something also very interesting that you can see in the financial data. If you look at the recipients from low and middle income countries, the number of recipients and the share of total global health funding dropped. In the last 6 months of the year after the terminations of awards, that percentage held by Global South recipients is only 9%. For more than 2 decades, localization has been an aspiration of U.S. global health policy. And the idea is simple. Send more resources to organizations in the countries where we are trying to do work. That builds local capacity and sustainability. So these are small and mid-sized NGOs that are embedded in HIV networks of patients, working with maternal child health clinics, organizing community health workers to do malaria prevention. They're the connective tissue between these large national programs and really effective programs working in communities. And for these smaller organizations that are operating with very thin cash reserves, a funding shock like this can be fatal. And we know that many of these organizations have closed. A year later, it's clear that there was no grand plan behind the dismantling of USAID. This is what incompetence looks like at scale. Now, building something from the ashes of this global health system is not going to be easy. Tearing down a system is easy. Building something that actually works is very difficult. And when funding systems are opaque and concentrated into just a few hands, there's a real risk, not just of inefficiency, but also fraud and abuse. So sustained public monitoring, including this dashboard, are really one of the most important ways to ensure that life-saving global health funding doesn't get diverted or quietly repurposed for something else. We're going to continue to monitor global health spending in this dashboard. If you have ideas, in fact, about analyses, just pop them in the chat. We'll make more videos about analyses as they come out. Just click on that subscribe button, and I'll see you next time.